Hey friends, this is Ian Khan here at HIMSS 25, and I'm speaking with industry leaders, innovators, the C-suite, just to understand where the next few years of healthcare are going. I have with me Hammad Shah with Clarest Health. Hammad is an innovator in the industry, a veteran in the industry. And so let's see what Hammad thinks about where things are headed. Hammad, welcome to the Futurist at HIMSS. How are you doing today, being HIMSS' second day,
yes.
I think? How has it been for you?
Today's been my first day.
Okay.
But glad to be here. Very nice to meet you. And thank you for the opportunity to talk.
It's our pleasure, and we love talking with people who are creating change and setting the tone for the future. What is Clarest doing right now? What have you been focused on the last 10, let's say the last 5-10 years? Where are you going now?
So Clarest Health is relatively new. I've been here since 2019. We are putting together capabilities, have put them together now, to really address med management. Med management is a significant issue, I think, in our society today. You have patients that are, as they age, transitioning between multiple places. They're preferring more and more to stay and age at home. They have an acute event and they transition into a hospital. Then they may recover in a nursing home or rehab center, and then they go back home. And what we find is the handoffs in that area are very poor. And it leads to ineffective and suboptimal medication management, and it leads to adverse events that gets them readmitted into the hospital. It's a vicious cycle. And we want to step into that space. We want to be disruptive in that space. We've now built the capabilities to really effectively not only risk stratify that patient population, to understand which patients we should be working with and targeting because they could benefit the most from our services. And then we've got the capabilities to provide them the services that we think they need to improve their outcomes. So I said a lot there. We can jump into it if you'd like.
Of course, and what I see as some of the things, and this is a big stack of things that you guys are trying to solve. Is there like a leakage in the big ship? Are companies and patients and losing time, money? What problem are you trying to solve? Is it efficiency of the industry? Is it profitability of the industry, or is it more better healthcare and shorter duration of lag times for patient cures and treatments?
Look, I think that effective med management and effective stratification of the patient population solves all those things that you mentioned today. There's a problem today where this bottom 1% of patient population that is on many medications, has many chronic comorbidities. They are the ones that are the cost drivers for a lot of the payers. You talked about elevation of cost. That's happening because of this population. As complex as that population becomes, you really need to intervene, not just with back-end analytics, but we also intervene in a real high-touch format to make sure that we're actually executing. So that population is leading to high cost. They also, because they don't have a high-touch environment or the right tools around them, their outcomes are poor. So it's a problem that's really compounding. And as our population ages, I think the problem gets worse. And the systems we have in place to tackle it, I feel, are transactional. So, if you were to go to a local pharmacy, whichever pharmacy that is, that pharmacy is incented on filling more prescriptions. I worked in retail pharmacy for a decade. Every year, my big quota was, well, look, how many prescriptions are your pharmacy dispensing? Never did somebody ask me, what are the patients doing on the other side? And their metric for compliance and adherence is, Ian picked up his prescription. Well, you could be picking it up or getting it delivered and then putting it in his medicine cabinet and never using it because he's confused about what to use. So we don't have the right systems in place. That's why Clarest Health is trying to enter that space, has entered it. We're going to be disruptive, and we're going to make sure that we look at all of those things: cost, outcomes, plus adverse events.
Are you looking into new technologies to help you do that? Everybody's talking about AI, a big part of the conversation, but it's not just AI, which is, the key to everything. It's also, looking at your data, looking at workflows, looking at all these different things that can automate, processes or what have you. What are you focused on?
So we absolutely are. We have a tool called MTM Path. it was developed and built by pharmacists. MTM Path can take in large streams of data. We typically put data that's pharmacy claims data, so we know what prescriptions people are taking. We also put in their comorbidities, so we understand the diagnosis for what they're being treated for. Then we've got algorithms back end that actually guide our interaction with that patient. So we use MTM Path to now help us guide that interaction where we question the patient and do a complete medication review. Based on the analytical data plus the live interview, we now get to a place where we can do the risk stratification. And the tools, the algorithms in the back, I mean, AI is a fat word, as I call it, right?
Yeah.
There's a lot of people using AI as a word.
Yeah.
I'm giving more details in terms of how we're actually doing it. So we're absolutely using technology.
What do you foresee the next 5 years to be when it comes to medication management? Where do you want things to be in an ideal world?
Well, I think that value-based care is the future. Today, there's a lot of fee-for-service that's very transactional. I don't think it can sustain itself because it's not focused on outcomes as much as it used to be. So if you go to value-based care, now you've got to focus on outcomes. And what has happened today is payers are working with providers to say, all right, well, if you've got a certain patient population, you need to reduce the cost of that trend line by not having readmissions, by having better outcomes. That trend line can only go so far without inserting med management into it. We think that us getting into those value-based care programs and then taking that trend line even deeper is really the future and the key. That's where we're headed.
What about costs of medication, right? It's something that's so important. Many people, and I was reading some stats, many people in communities and income brackets where it's challenging for them to get all prescriptions filled are skipping their dosages. They're not getting enough medication, right? Because the costs are high. You then have companies that, I believe it's Mark Cuban, he has a company and they're focused on very low cost medications and breaking this big mold of what we already have. Where is that part of industry? And I'm coming into it with zero knowledge of where it is, and you know so much more about it. Like, where is this divide? And what is happening? Help us understand.
Well, look, there's too many players in the mix. If you listen to Mark Cuban and you really diagnose what he's saying, he's really pointing to the PBMs, the pharmacy benefit management companies that are really controlling, they're the middlemen controlling reimbursement to the pharmacies, and they're the ones working on behalf of the payers. And what Cuban is saying, not my words, his words, there's a lot of value that those PBMs are extracting, and they're not very transparent. So he's trying to disrupt that model. That, I think, is a key area for us to focus on.
Okay, good. What do you see happen in other parts of the world? Like I primarily live in Canada. It's the same as the US. There's hardly any difference in terms of costs or what have you. But are you looking at other trends that are happening in, say, Europe or Middle East? Like, what's your read on the big picture?
We would like to I think these challenges exist everywhere. So, short answer to your question. The longer answer to your question is, we think there's great opportunity to tackle these issues in the US. But these analytical tools that we have developed, these services that we have developed, we think can work in other environments because they're not completely dependent on the price of drugs, right? So a lot of organizations that are in the pharmaceutical space are reluctant to go to different areas because the pricing of meds is very different. Europe negotiates all their med pricing. It's much cheaper than here, right? Canada also negotiates some. It's cheaper than the US. So our focus is we don't care. We want you on the right meds. We want the services around you to make sure you're compliant and adherent. And we want to target the right patient population, keep them out of the hospital, and make sure they've got optimal therapy. That model works internationally. But we've got a great opportunity in the US. We're going to focus on that first before we go anywhere else.
Amazing. Well, Hammad, thank you so much for sharing, the last 10 minutes with us. We really appreciate it. There's way too much happening, and I feel like HIMSS has got some really good things happening this year, lots of good conversations, and you cannot attend everything because it's so big and so spread out. But thank you, and we wish you guys all the best, and hopefully we'll see you guys in the future and see what you've been up to.
I really appreciate your time.
Thank you very much. Thank you.